Let's try to know about some basic MRI imaging sequences. To start with, T is time when the signal is acquired. Based on that, you have T1 and T2. T1 weighted helps you understand the anatomic image of brain, where water is hypointense, CSF is hypointense, white matter is white, and gray matter is gray. When it comes to T2 weighted images, you will see that water and CSF are hyper intense. You can clearly see them much brighter. And the white matter will appear black or darker, and gray matter will appear white or brighter. So it's known to give you a better understanding of pathological image. Okay, pathology is understood better. Now, if you talk about the sequence called FLAIR, the sequence called FLAIR is called fluid attenuated inversion recovery, where it is a T2 image with blockage of signal from fluid like water and CSF. So in this, you can see that the white matter is appearing dark and the gray matter is appearing white, unlike the T1 weighted image. Now, in this T2 weighted image, you can see that the CSF is actually black. So this is the FLAIR, fluid attenuated inversion recovery. Appearance of CSF is dark, signal intensity gray matter is more brighter than the white matter. It'll help you visualize pathology. Certain pathologies that are understood better in FLAIR, you can see there is a lesion. It is not a fluid filled lesion, but it is more of a tumor or some other kind of a lesion. So, once you attenuate the fluid in the sulcal spaces and as well as the ventricles, you can appreciate the pathology better. Next, let us try to understand diffusion weighted imaging. Diffusion weighted imaging is not a single image. It always runs along with the ADC map, that is apparent diffusion coefficient map. So you do something called restricted. In case of restricted diffusion, you'll have an image that is bright on DWI and dark on ADC, apparent diffusion coefficient. In case of an acute infract, in the patient comes within 5 to 10 minutes of onset, you can do a DWI and come to a good diagnosis of the infract. So this is a DWI image. It is showing that this area is infracted. The inference is obtained only after you see the ADC map as well. On DWI it is bright and on ADC it is dark. So this